What is the science on this? Are they right to be this concerned about Leicester? They should lock it down again?
Well, any uptick or any significant uptick, and I think this is, in the number of diagnosed coronavirus cases in any conurbation is of importance. It could spark a much more serious spread and a much more serious outbreak of disease and hospitalisation. So the fact that this is one city, Leicester, is accounting for about 10% of all new diagnoses nationally, or in England anyway, is really quite significant.
Well, what nobody seems to be able to explain is why. Why has Leicester got 10% of all the new cases?
Nobody really knows. You might hear some people posit arguments and fly some kites on this one, but that's all it is, kite flying at this stage. The truth is, right now, nobody really knows for sure.
Well, let's talk to a councillor from Leicester, Russell Al-Govind. Are you clear about why Leicester is suffering right now?
We are clear up to a certain extent, but I think the government has left it too late to tell us at the last minute. They should have done that a long time ago.
Because the government has known for 11 days about a potential problem in Leicester. It does seem an extraordinarily long time that they've taken this kind of action.
To be honest, I mean, this is just a conversation that started only yesterday, more conversation. They did 11 days, the conversation was there, but no clear sign or no clear information.
OK, but you, sorry, Councillor, you did say that you had some idea about why Leicester is particularly affected. What would you put that down to?
Well, it's lack of information, lack of language barrier issues, diversity. Leicester is a diverse city, so there should have been some sort of a different language information should have gone out by the government, and it cannot be just depend on the local council to do everything.
Do you think that's part of the problem, that the government hasn't issued translated information to target the different communities in Leicester, and therefore the information about self-isolation is not getting through?
Well, in a way, yes, and we are doing our best to get a message across into the community to make sure 2 meter distance are kept according to the guidelines.
OK, well, let's bring in Dharmesh Lakhani. You're a restaurant owner in Leicester. I'd imagine this is incredibly dispiriting for you and every restaurant owner.
It definitely is, Piers. At the end of the day, we are shocked, but we kind of expected it after the past 11 days of all the hype in the media. Unfortunately, it's only been, brought in last night, and it's very, very disappointing.
How long have you been able to reopen at all or not?
We fortunately we have a takeaway section, so we've been running that for a few weeks. We did initially close for a number of weeks, but our main trade is a restaurant, and people come from all over the country to the Golden Mile buying saris, gold, so many items, and this is going to put a lot of people off, and we really, really are worried about it at the moment.
Because you were planning, presumably, to open your doors on Saturday.
Yes.
And now Matt Hancock said that that's not allowed.
Well, it's thrown a spanner in the works. I mean, the confusing thing is there are boroughs which are 4 and 5 miles not far from us where shops and restaurants and other things are going to be open. So, what type of lockdown is this?
You see, that's the problem.
I don't see it working.
Simon Clark, that is the problem, isn't it? I mean, if you've got places 4 or 5 miles away, which are going to be open on Saturday, restaurants, bars and so on, young people, they're going to be tempted to go in a Uber or whatever, or drive themselves and go to a neighbouring borough, taking potentially the infection with them.
Absolutely. This is a potential problem. As I understand it in Leicester, they're not going to be closing the roads. They're not going to be sealing off the city or anything extreme like that. So this is a real possibility. There will also be people who presumably work outside Leicester, live there, but work outside. So they're going to be commuting, one assumes. Otherwise, what's their employment situation? Are they going to be expected to live on statutory sick pay? So all of these things are important factors. You're quite right.
I mean, one of the interesting things to me has been the way that young people in particular, ever since Dominic Cummings pulled his stunt to bend the rules and keep his job. They lost a lot of young people with that in that week, I think. And it's hard to get the young now to go back to locking themselves away again because they still think one rule for the government people, one rule for us. But if they don't do this in Leicester, Simon Clark, I mean, there's going to be a far bigger problem to deal with.
Yeah, and I think with young people, it was actually quite difficult to get them to do it in the first place. And I think over the past few weeks, we've seen a quite generalised, in fact, reluctance to follow distancing and hygiene and all the rest of it. But you're quite right, again. It will be like throwing a rock into a pool. If we don't lock down or don't deal with Leicester, then it will spread out to other surrounding towns and cities, and that will be more rocks in the pool.
Yeah. Simon Clark, Simon Clark, the schools have been closed and will be closed from Thursday. Now, we understand that school children are at lower risk. They're not as likely to suffer the effects of the virus compared to other sectors of the population. Why have the schools been closed?
Well, that's a really good question, and I think we need greater clarity on that. The children are not at great risk, you're quite right. Well, not zero risk, but not a very high one. But, of course, older or relatives who are elderly or perhaps have underlying health conditions that they may live with are. So while we weren't expecting children to be big drivers of infection of this disease, of COVID-19, unlike influenza, for example, perhaps they're more than we realise. That's certainly beginning to be seen to be the case, at least in Brazil. They're probably more of a driver of infection than we'd realised.
As a microbiologist, obviously we've never seen anything quite like this in our lifetime. But at the moment, we still think only 5% of the UK population may have had this virus. That leaves a very large number of people, many tens of millions, who haven't had it. How worried are you about this second wave issue, particularly if it was to collide with, say, a bad flu season?
If it were to collide with a bad flu season, that would be really, or potentially, would be catastrophic. If it is a bad flu season this year. It isn't every year. It needs to be remembered that some seasons can be quite mild, but that would put even greater pressure on the NHS. We don't know how big any second or third or even subsequent waves might be. We won't get rid of this anytime soon. I saw Hilary Jones on your programme about an hour ago, and I agree with everything he said about that. This isn't going away anytime soon.